meeting that code. So that's fine. We can send the recording to all of you. So how is everybody, Vijay?
Kranti is all right. So she's just getting the kids to dinner. I am down. I tested positive on Sunday. So
Okay.
I am isolating myself. But
Okay.
she's okay. She's not, no nausea is gone. Everything is gone. Yeah, I had a bad throat till yesterday. Today I'm okay. Today I just have some sniffling and all that.
Right.
Hopefully should be all right soon. How are you doing?
You're doing good. Like we have one case in our floor and some 7th floor also is now. I think it's just going on one after the other.
Yeah. Almost every day, morning and evening, we are hearing about new cases in Lavender.
Yeah, I know. Hi, Smriti. Good. People have remembered to join. It's a good thing because I thought I have not sent a reminder. So let me just share the screen now. Hi, Smriti. Can you have your video on?
Hi.
Yeah, you are audible.
Hi.
How are you?
Yes.
Good. You're able to see the screen, right?
Not yet. No.
It's coming up. It's coming up.
Okay.
And now we can.
You can see, right?
Yeah.
Yeah, yes.
Okay, let me just do an F5 and quickly you can see. So Smriti, Harshika has also joined? No, Harshika has not come. Okay, so we have 2 candidates here who never knew that they had COVID. Okay, so the message which I want to give out is we might not want to take Omicron also very lightly so that we are, recovering milder. It's a milder disease, but we are seeing a lot of long COVID coming up in a lot of our patients. Okay, so the patients in UK or South Africa apparently have shown a lot of issues. Okay, what happened? Stopped as a shared window. I don't know what happened to my screen. I just shared it. Maybe the connection issue, is it? Did you all see the screen?
We were seeing it, but now it's gone.
Now it's gone.
Okay. Let me go to there. So I'll continue with the talk. Is that we keep thinking that we have recovered. Many people have been asymptomatic, but be very conscious about a lot of symptoms which we are seeing in a lot of our patients from UK and from South Africa in terms of long COVID. Now, as Smriti and Farida and all and Kranti, you all fall in the same category almost. You never knew that, like Kranti knows, but Smriti and Farida, both of you never knew that there was something called as spots. Okay. So Smriti, what was your symptom? Just tell me. Smriti, what did you क्या आपने देखा था? What did you feel? Like you stand up and you feel like you'll fall off, right? Hello?
Hello? हाँ.
Yes, Smriti. So when you stand up, do you feel that you can just fall off or something?
हाँ, पल्स बहुत ऊपर जा रही थी मेरी और मुझे बहुत ज्यादा मतलब टायर्ड फील हो रहा था
और चक्कर जैसा लग रहा है, राइट?
चक्कर जैसा, हाँ.
Okay, Farida, how did you get in touch with me?
I got in touch with you because I had palpitations, and yeah, after I spoke to you, I got to know that the palpitations come on when we changed our posture from sitting to standing or lying to standing.
Correct,
But
correct. And
palpitation.
yeah, and Vijay Kranti is also used to feel this prior to even COVID existed, right? During the time when she was pregnant.
Okay.
Correct. Correct. During her
Correct.
pregnancy, she had severe nausea also.
Yeah, so Smriti is also postpartum, and then we see a lot of these issues coming up with people who already have this phenomena called POTS. Okay, so what is happening with long COVID is just not POTS. We feel a lot of body pain and back pain also showing up in many of our patients, which can be lingering on with arthritic changes in the joints. And also what is called as a Sika syndrome, like your eyes remain red in color and you might feel a lot of burning sensations in the eyes. And that is the thing which I wanted to give out a message is that to recover from post-COVID, or whenever you don't even know that you had a symptom per se, uh, most possibly, even the symptomatic or the asymptomatic will carry forward with a long COVID symptom for 4 to 5 weeks, and they might go on for a longer time period also. We never know who will carry on for a long period. Now, the key thing to important is what you are eating during your recovery phase and the kind of workouts which you are doing. So don't strain your body, first of all. Second thing is don't go running and jogging and upright exercises so soon or too soon. If your body is healing better, you get your virus load very much down. You can just kick it off in very less time period. So most times, most of the viral fevers will present as post-viral fatigue or post-viral POTS, POTS. Now this post-viral POTS, like in case of Farida, we'd never know. It's an unknown discovery for her. In case of Smriti, it's an unknown discovery for her. So what Vijay I'm saying, what is our atmosphere all around is all networks, okay? All Wi-Fi networks and all. I've told Smriti, I've told Farida, I've told you to please don't go on to 5G networks because your viral load or your heart rate will jump up if you have a Wi-Fi network, which is not being able to controlled by the body ANS mechanisms, okay? Now, what happens is like, sometimes we are very, very quick to understand these little things that my heart is going up by having the symptoms. Many people like Smriti just felt like she's getting up and she's chakkar aa rahe hain usko. Okay, Farida felt in the night that she's having palpitation. Now Kranti, she had affected with COVID now, but now she's feeling like she can't eat food. She's not able to digest food. So that's again another symptom of POTS which we see. Okay, so what are the things you have to understand is don't eat a big meal, all of you. All of you, whoever is recovering, whoever has got not a big plate of meal, because when you eat that, your BP will try to, get your heart rate real up because your blood is going towards your intestine to digest the food, one thing. So have a food which is like a bowl, okay, bowl food of food. I told Kranti also the same day, just little amount of food in a portion size throughout the day is the key thing. Second most important thing is not jumping around and going for a long walk when the sun is on. So what is happening is when the sun is too high in peak time, you can go for a small walk early hours or in the evening hours, but avoid the very harsh sun. Now, when you have a very harsh sun, you can actually, kind of cause a very different in the sympathetic system. Hi, Dr. Vishali. Thanks for joining from US. Hi, Dr. Vishali. I don't know. My screen is not coming only. Okay. Let's see what happens.
So, doctor, when you say very hot hours, what are the hours to avoid?
What are the hours to avoid is the peak sun between 11 to 12 and 10 to 12, like that period of time, because that is the major time when your, your sun is really high and the ANS system reacts very much with your bodily systems. Like, when you are in an environment which is controlled by your ANS system, whether it's a hot, whether it's a cold, they all will get affected actually. So what we have to really understand is keep your temperatures in a very cool and a moderate level whenever you are stepping out of the house, to control the ANS to not get bad for you. Okay, so the heart rate will jump up only when the temperatures are too high or the temperatures are too cold, because our body systems will be kind of changing with the weather conditions. And our ANS, which is the autonomic nervous system, is getting very much affected with the temperature change and with the amount of food which we are eating and with the amount of position change we have in a day. So somebody who's recovering out of COVID should not just jump out of bed and go and do things. That's one thing. Take your time, move into the bed into a very, low pace manner, slowly count 1 to 10, and then one should try to get up. That's one thing. Second thing, as I mentioned, is small amounts of food which can be taken as small portions of food rather than a big meal. Because whenever you're having the big meal, you're driving away all the blood pooling happening is in your intestine. And now when that is happening, what is happening is you start to feel dizzy. You start to feel like you would just kind of fall off, or you feel like there's a syncope. So these are the possible symptoms which we are seeing in long COVID. And another feature which we see in long COVID is gross muscle pain or joint pains or autoimmune conditions in the form of arthritis is developing a lot. So I see maybe in a 10-day period, I'll see about 20 patients who just had something called rheumatoid arthritis, like small joint pains in the wrist, pain in the back, pain in the neck. So most of them is because the viral shedding continues for some time period, and there's an inflammatory markers which remain behind for many of these patients. Now, I think the WHO has already said that we shouldn't take Omicron lighter. The only reason I did the talk was because there were so many patients. I wanted to really let them know what mistakes we did in the second wave. We don't do it this time. So the most important thing is we are seeing a lot of asymptomatics who never knew that they had COVID are presenting with long COVID symptoms after 4 to 5 months of the second wave. So the key thing is whether you are around with somebody who had COVID, whether you are working in an environment where there is like Dr. Vaishali and a lot of doctors are there, we have to make sure that we do the right things and do not engage in high intensity exercise very soon. So we have to make sure we are exercising optimally, which is mainly in sitting position rather than upright positions. And a lot of focus has been given on yoga and Surya Namaskars by people and a lot of yoga acharyas and all. It is good, but it has to be not done when somebody is recovering out of COVID for the first initial weeks and months, because there's a complete change in positional heart rate when you are bending down, when you're coming up. So that orthostatic hypotension, which we see in these post-COVID scenarios, will put a lot of strain on the heart. So that's another thing which we should not be actually trying to dig deeper into, and then only we'll get more reports as to why it's happening. Dr. Vishali, are you seeing any long COVIDs in the US? Hello, Dr. Vishali, are you there? Hello. Okay, I think she must be busy. So, and the key thing we see is especially POTS is there in women. And why so? Because our bodies are very much dependent on the hormones, which are the estrogen and the progesterone, and also on the cortisols. Now, when you are in a stress environment, when you have fought something called as COVID, whichever way we call it, there's an environmental trigger which is causing your body to really fight this kind of a cytokine storm which builds up. Our body is not used to this outside trigger. And whether vaccinated, whether not vaccinated, we are seeing long COVID in the same phenomena in all the people. So a lot of my friends with updates which have come from UK and US now is people who have got the boosters, who have been vaccinated thrice, are healthcare workers, had long COVID from past 2020 till now had a very bad bout of long COVID coming after the vaccination also. So it's just that what you are doing in the initial period, whenever you are getting up, that's very important. How you are eating, that's important. And making sure that you're not going out in the, very hot sun in the early hours is better, but not in the morning hours, like between 10 and 12. There's a time period when one should start to be inside the house or maybe go into an indoor kind of setting rather than be right out in the open, because that's again affecting the heart rhythm for a lot of people. Now, what are the consequences if I exercise upright, I go running within the short period of 1 month or 2 months? You see now there's been increased rate of people going to the gym and then just passing out. We've been hearing a lot of issues with heart attacks happening, uneventfully issues happening. So if your heart rate on standing, on resting is over 100, if you are exercising at a higher intensity, your heart rate will jump up to a very high level. And that is the kind of risk factors which we don't want anybody to suffer. And at the moment, it's a big elephant in the room because a lot of our clinicians, especially in India, in UK, are not aware of this long COVID phenomena, what is happening. And many of the times patients are being told that it's just anxiety. Now, a lot of patients here would agree to it that initially they were told that it's anxiety, there's anxiousness over there. But when you actually do this sit to stand test and you do the pulse oximeter reading, that's when you can do a confirmatory diagnosis that somebody is having a long COVID POTS. Now, when somebody is having a long COVID POTS, we will have to really understand what medication that person should be given. Because many times doctors are just giving you a hypertensive pill, but what kind of a pill is very accurate for that heart is not being talked about. Now, when I think in the coming scenario, a lot of doctors are actually coming to, really understand that there is long COVID in few of the hospitals in India too. So that's one of the biggest boon which we'll have. And the growing concern is with Omicron and with so many asymptomatics, how many of the long COVID we'll have in the coming months. So the word of advice to all of you or to everyone, you can pass on the messages, please go slow. Listen to the body. Do not exert yourself in the initial days of recovery. And also important thing is what you eat in a day is very important. As I said, no big buffets, but have small short meals. That's very prime and very important. And as I said, with yoga asanas and breath work and a lot of breathing controls and all, which I do conduct the sessions for post-COVID and long COVID people. And our programs are very much determined by making sure your body's exercise tolerance improves. Now, what do you mean by exercise tolerance is that I want to walk from my room A to room B, or I want to do my activities of daily living without feeling breathless or without falling down. Now, like for Smriti, like she never knew that what was happening to her. She would always say that she's feeling like she'll faint, right, Smriti? And as a result of that, somebody in the family is not aware that she's having something like this. What can go wrong is that, like they just think she's just fallen down. But it's just not the fall. It's just a heart rate which caused our BP to just fall off. We have multiple kinds of POTS. We have about 4 to 5 types of POTS. Sometimes it's very related to your hormone cycle, sometimes related with your BP cycle. We have androgenic POTS. We have hormonal POTS. So in whatever way it is, we have to understand that anytime, whenever you are getting up from sitting to standing, we got to be very, very careful. Now, another thing which we always talk about in long COVID scenarios is people are having long-term issues of cough, cold, and breathlessness, which is lasting forever. So the report which has come from, the reports which have come from Kerala as of now is people who had Omicron got better in 2 to 3 days. Now they went back to doing all shopping and a lot of stress for the heart. And now they are showing after 10 to 15 days that they're coming back with a lot of breathlessness and cough, few of them. Perhaps they already had a second bout of COVID in the second wave, and then they get this issue which was lingering on for them. So probably they already had long COVID, and then that's what presenting in the third wave of Omicron too. So key thing is go as slow as possible for your recovery, because we are not wanting to race anybody, and we are not here to win a competition for anybody, and we are here just to make sure that we do the right stuff in the initial days. Now the key thing is the water and the salt. So it depends on person to person, how you increase your hydration, how you increase your water intake. It's all up to you and up to the weight of a person. Now, in many of the times, people who are having too much of caffeine-induced drinks like coffee or tea, that's something which I'm asking people to avoid. And third, and not the least, is your vitamin B12 levels. People who are deficient in the B12 levels definitely are showing up with gross change with long COVID symptoms. Now, the long COVID symptoms, because why we see as physiologists, because we deal with autonomic nervous system on a daily basis for our patients. And, like people will feel that it's anxiousness, but it's not anxiousness. It's just about understanding what it is. Now, people who are taller will need extra doses of water as per the people who are a little shorter. I've told a lot of you all who have already been in touch with me to increase the water intake and a bit of salt intake for all of you. And also keeping in mind that you are getting up in the morning, having a glass of water by your side. So start your day with something which is watery, which is more liquidy in nature. And as I said, not bigger meals, smaller meals, that's important. Now, another thing which we are seeing in long COVID is not able to get back to exercising even after 4 to 5 months of time. Now, why is it happening is because your body is deconditioned because of the POTS phenomena, which is being existing in many of the people. And the reason being that we try to push you and then you have a relapse of POTS. So POTS cycle is you're good this day, you might fall down the other day. So it's not a very linear curve. It's a topsy-turvy roll. But people who already had POTS and now get COVID will have a bad phase of long COVID for a few days or a few months. But many of them have recovered in the time period of 4 to 5 months with the post-viral fatigue. But somebody who already had a phenomena POTS existing in their bodies, which they never knew about it, may also recover in 4 to 5 months if they do the right conditioning of their bodies. Now, the key thing to also remember is not to take too much stress. Now, what I mean by stress is like any kind of news, any kind of trigger, which might cause your cortisols to go up. And as I said, many of the times these spots are actually linked to the hormone called cortisol or adrenaline drive. So your body is already in the fighting mode. You see a tiger coming, so COVID fourth wave coming, COVID fifth wave coming, all the news channels throwing those news on you, you should shut them off. And when you shut them off, do the right thing for yourself. You are not going into a fight and flight syndrome, because your body with POTS is already fighting something which doesn't happen in most of the other body's conditions. So we'll have only 4 minutes remaining, I think, and I'm open for questions from everybody. Short and sweet. We'll keep having more people coming in. And on request of Farida and Smriti and everybody, I wanted to do this talk. I know there are so many others who haven't been able to join because they're all working, but I'm open for questions. Yeah, Farida, Smriti, Vijay, Dr. Vaishali, if you're here.
Thank you so
Quick
much.
question, doctor. What is the diagnostic test for? Sorry, go ahead.
No, go ahead.
Yeah, Vijay.
Sorry, quick question. So what is the diagnostic test for determining if you have the POTS? So not just for Kranti, but I'm also asking for children because looks like both of them are asymptomatic right now.
Yeah, so Vijay,
What's a good way to diagnose it for them also?
We'll wait for a few days till their viral load comes down, because many of the time when they have the infection, they also show up with POTS. Okay, so I mean by they are small kids, and especially for Anaga, I will have to rule out. We'll do 1-to-1 for her and rule out that testing for her. So we do that as for Kranti, the same testing which I did for Kranti, the same testing we'll be doing for the kids also. Yeah, the other day we did it right for her.
Thank you.
Yeah.
Yeah, with the pulse meter. Got it.
Yeah, Farida.
Yes, I am okay.
Thank you so much for this meeting, doctor. You said 10 to 12 is to be avoided. What about the afternoon hours? Any particular hours to be avoided other than 10 to 12?
I would also say between afternoon, around your lunch break till your 2 o'clock, when the sun is almost peaking and then it's kind of receding. Why I say so is because, as I said, your body is dependent on the hormones, the cortisol and the adrenaline, right? And when you get up in the morning, your cortisols are supposed to be a little higher on the side. And as you go towards the evening, your cortisol goes down. Okay. So the super drive manner for your body is little lesser. So you will be able to deal with the orthostatic intolerances very well when you are walking in the early hours or in the dim light in the evening. This is especially for people who are having this long COVID sequel. And this is not for people who are all fit and fine, okay? Because you want the morning sun, you want the vitamin D absorption. But many of my patients are not able to see the sun also. They just kind of fall off. In a second, they just fall off. So these are things which I'm seeing quite widely. So I don't want people to just keep falling down multiple times. You know, I have a patient, she's not been able to come here because she can't see the screen only. She can't concentrate. She has so much of brain fog, and I'll just record it and send the recording to her. But the thing is, what is happening is when you stand up all of a sudden, there are people who have fallen multiple times, 10 times. Okay, and now when you fall down on the ground, you might just injure the shoulder or the arm or the hip. And you're on a, at the age of 35 or 40, and you have a fall, it's not easy to deal with those, injuries and all. So that's why, Smriti, we also are focusing on doing everything and lying down and sitting. Because the moment we do in standing, Farida has picked up on and she has progressed greatly. I hope we would have it with other people also. But as I said, Farida, what's your word of advice to people?
I think following your advice is very important. And I am actually a very physically active person. And for me to not even being able to sit and do any exercises was very difficult. But I think under your able guidance, I have progressed from from the sitting exercises to the standing, and the last 2-3 days I have been jogging, and for me that is a delight.
Good. And how's the heart rate doing for you now?
Heart rate is doing well now. I think it's pretty much under control. Not like it was earlier.
Yes.
Yeah.
And how about getting up in the morning or in the night, as you said first? So initially people will say, no, not getting sleep. They are feeling like the heart is just jumping and they just want to get up.
So what is happening is when I put my head to the pillow, I can hear my heart thumping and pounding. It's such a scary feeling, But then I have, see, some of it could have been also my anxiety acting up. Sometimes it is imagined and sometimes it is the real thing. So I have sort of learned to deal with that, accept it. And yeah, now I just tell myself, okay, it's okay. It's just my imagination and I go off to sleep. And sometimes when it gets a little more, if I'm anxious due to some other reasons, what I do is I just, turn onto my back and I just sleep on my back where I don't have a chance to, get to listen to my heartbeat. So that is
Good.
helping me quite a
Very
bit
good.
actually.
Wonderful. Smriti, how did you understand there was something going wrong? Smriti, are you there?
Yes.
Yeah, you can have your video on, Smriti.
Oh, okay.
Yeah, Smriti, tell me.
Yes, ma'am.
Yeah, tell me like, hi Vijay. Oh, thank you, Vijay. Yeah. So what did you feel initially? What did you feel the symptoms were?
Symptoms actually fatigue and leg pain, wrist pain, lower back pain.
And chakkar?
हाँ.
And कभी कोविड का कुछ पता ही नहीं था कि कोविड हुआ भी था कभी, right?
हाँ. कोविड टेस्ट करवाया भी था पर उसमें तो कुछ भी नहीं आया.
Yes, वही मैं बोल रही हूँ. So as I said, we have lot of people who are asymptomatic, जिनको ये symptoms आ रहे हैं. They don't even know when they were exposed. Okay, so these are the key things which we will have to understand, that ki heart rate is going up when we are standing. It's not normal in a normal day-to-day scenario. That itself is telling a story that perhaps we were exposed and we just didn't show as symptom, but we do have long COVID now. Okay, so and we have the long COVID pods, and how to do the exercises with this condition. As I said, build up your exercise capacity only by sitting and lying down. And then gradually, as Farida has advanced, a lot of patients have advanced now. Okay, so they go on to doing things, standing up, jogging, running. So Smriti, no jogging, no running, as I told you, first day itself. फरीदा से सीखो, वो बैठ के अपने को ठीक कर रही है. ठीक है? Yeah. Anita ma'am, any questions you have? Lovely to see you here.
Hello, Dr. Anjali. Yeah, I just wanted to hear you because see, last Monday onwards, I was not keeping well. Like, I don't know whether it's really COVID or not because I'm also part of network, what you say, like nutritional products from past 10 years. So there was one product, Ayush 64, which has come, and I wanted to try it out to as a precautionary base. When I started taking that, I started getting sore throat, all those things. After starting that only till date, I was perfect. So I'm so much confused whether I got COVID or not. Then after 6 days, like Sunday, we thought, okay, let us do a self test, because every 2 days, someday my throat will get some problem, or back is getting problem, like, entire, what is a spine area, that area and all. And 2 days, motions kind, what is happening. Then Sunday we have done self test, in that I could see a very mild light line. Then immediately my husband has put me in quarantine. I was cooking, I was doing everything last week, and all suddenly from Sunday they have put me here, and which I'm really unable to take it. I can't be in room, and every time I want to cook. I have grown up sons, but still I feel that, as we always say, only mother may know the right amount of food what they take, right? Even I may give dal rice, that is a satisfaction. Yesterday even my son was crying, younger one, he's 19, he was crying all suddenly. He says, what dad he's bringing and giving, he's not giving that satisfaction. So I was feeling, so I want to cook. Unnecessarily sitting like this, it will make me sick. If I'll be active enough, cook and do my work, I think I'll be fine sooner. That's what my feeling. I don't know whether it's COVID or not. Still, we are in a doubt. But I'm feeling bit low. And the last 2 days I was okay, but today again I was a kind of palpitation. As you said, there's something happening. Like, all suddenly you just wake up and sit, you say that something is going wrong, and check everything. Every 2 hours I'm checking my this things levels and all are normal. Like it's 97, 98 pulse oximeter, and my fever and all, it's 96.4, 97, like that only. Every time I see, like when I'll travel in metro, everywhere they check that temperature always there from years together. So there's no change in temperature. Like entire in 10 days, I'm at seen only once 100.4 and once 100.7. That's it. Rest all every time it's very normal temperature what I have. So I don't know whether I have to consider this as COVID or not.
So Anita ji, I will say whether you are positive, negative, doesn't matter. Isolate, that's the word. And it doesn't matter what kind of fever, cough, cold, flu, anything. We're just considering it as COVID for anybody in the scenario which we have. But only thing my request to is rest and eat well. Rest and eat well. The only word of advice is assess yourself, rest. Assess yourself, rest. So, a lot of people, what they thought is, okay, मैंने COVID को fight मार लिया है. You know what has happened in the second wave? People are following all the celebrities, okay? The people who are running or jogging. Oh, I fought the COVID, now I will do running, I'll do jogging, I'll lift weights. After that, they are actually causing a lot of damage to the heart, which I don't want for anybody. What I want you all is to recover in a very smooth way. Okay? Mountain is there. Reach that mountain slowly. Don't jump to the mountain. Okay? That's one thing. And little task. Don't overspread your work in a day. Pace yourself, rest yourself, and assess yourself. So, अगर मेरे को लग रहा है कि आज मैं नहीं चल पा रही हूँ, मैं रुक जाऊंगी, मैं सो जाऊंगी. One word of advice. स्मृति, ज्यादा काम नहीं करना है. मैंने बोला है रेस्ट करने को तुम्हें. ठीक है? So these are the key things.
Okay.
If I may add, doctor, my own experience. Anita, I can understand how you must be feeling. You want to be active and you feel that you're going to get well sooner if you're that way. But I think right now you should be resting when you're not feeling up to it. The more you rest, the faster will be your recovery. I mean, see, for me, it was very frustrating. See, as soon as I stepped into the kitchen, I would feel so cold. I would feel so weak. The palpitation would just come. And then I would just come down and lie down. Lie down for maybe 5-10 minutes. Sometimes
Guys,
it is a little
we
more
have
than
1 minute only. We have 1 minute to close, okay?
Okay.
We'll rejoin.
Can we rejoin?
Yeah, with same link we can rejoin.
Oh, I have 2 to 4 meetings in the UK now.
Okay.
So
Yeah, I'll keep doing it again. We'll do it on a weekend again, okay?
Okay. Yes.
Yeah.
Also, I was asking doctor to create a WhatsApp group for us so that we can share our experience and motivate each other and what we are doing to cope with it. So that way we can share our experiences and motivate each other to take the required rest to recover faster. See, what is happening is in the mornings between 10 and maybe 9 and 9 to 10:30 or so, I'm like down. I'm doing nothing. I'm just sitting there.